Okay, you guys can start whenever you're ready. All yours.
Okay, give me 1 second.
I think we should introduce all the panelists.
Yeah. Bismillahirrahmanirrahim. I think we have at least some good number of people. Salatu wassalamu ala Rasulullah sallallahu alaihi wasallam. Thank you, everyone, for joining our community Q&A. We have a good lineup today. Thank you both, Dr. Khalid and Dr. Chima, for your time. May Allah put barakah in your time and your family. Just quick housekeeping information. While we're going over all the knowledge that we're going to receive today, if you have any questions, please put them in the chat box. And during the Q&A session, we'll have both Dr. Khalid and Dr. Chima to address them. And if there is anything that we are not able to cover, you can always reach out to us, and then we'll get you the answer, inshallah. No further ado, I will let first on top of my screen I have Dr. Chima introduce himself, and then next Dr. Khalid, please. Salam alaikum.
Assalamu alaikum. Dear brothers and respected sisters, my name is Dr. Waqar Chima. I'm a cardiologist by profession with my initial training in Pakistan and postgraduate training in United Kingdom and United States. And I am consultant cardiologist at a local hospital for over 20 years, and also chief of a department and member of various organizations. I will be participating in today's discussion to the best of knowledge and research we have collected so far. Thank you.
Brother Khalid, please go ahead.
Assalamu alaikum. My name is Khalid Isa. I'm a pulmonary critical care physician. I graduated from Cairo University, and I currently work at Good Sam Hospital, Good Samaritan Medical Center in Brockton, Massachusetts. I'm the chief of pulmonary and critical care there at the Good Samaritan Medical Center.
MashaAllah. May Allah bless you all for your time and for your effort in our community. So today we wanted to have an update from our very first session, which Dr. Chima and Imam and I believe some other brothers have hosted. And we thought it would be good to provide good medical evidence updates to the community, because a lot of people are anxious. We've been quarantined for almost going 8 weeks now. We don't know what the future will look like, but we do know some new information about the disease. So we would like to have you share with us what you see in the front line, because you're also frontliners. May Allah bless you for that. And then what can we do as a community to help flatten the curve, as people say? So no further ado, I will just go on the next slide and have Dr. Khalid give us a quick update, inshallah.
Yes, so I'm just going to start with sharing my screen. So I just to let you know, I work at Good Samaritan Hospital, which is located in Brockton, Massachusetts. And Brockton has been one of the most highest rate of infection of viral spread in Massachusetts. Brockton has over 2,000 cases. Between Brockton and Chelsea, both are the highest infection rate. So as we can see here, Rakib, you guys can see my screen, right? Yeah, okay. So as you can see here, this is the daily new cases in Massachusetts. This is down here, how the date and how many cases we had every day, new cases diagnosed. According to the authorities, our peak was around the mid-May. This was around the peak over here in terms of the new cases, infection new cases. We after this period, this doesn't mean we're done. We have right now we are in a state of a plateau or a steady rate of new cases around 2,000, around the plus or minus 2,000 new cases in Massachusetts every day. There is some variability on the number of new cases. As you can see here, there was a spike here, about 3,000 cases. But this is also, as you can see here in the second curve, in the second figure, that you can see that this has some sort of relation to the number of testing being done every day. Over the last week to 10 days, there has been much easier to get testing done, and much more facilities have available testing. So you can see here that the number of cases, the number of testing per day definitely went up. So the number of new cases not always reflect what's going on with in terms of the community spread of the virus. But from other resources and the number of patients in the hospital, we have reached a steady state. This doesn't mean we're done. This is still a very critical phase right now. We were able to flatten the curve so the healthcare facilities can provide care to patients. But right now we still have it. There is a very high community spread ongoing, and we still have a lot of patients coming into the hospital with new infections. And this is here goes in down to the number of cases by counties. This is our county, Norfolk County. We're probably the fourth county, 6,000 cases in Norfolk County. And this is actually just a map that shows you where I think it doesn't go by number of cases, it goes by rate of infection. And you can see that the Plymouth County where Brockton is has one of the highest rates in the state. So I will, I'm just gonna, this is pretty much this is also the number of deaths as we go through every day. And again, the peak was around, again, the middle of April, and you can see that the number went down a little bit afterwards. So I think I will probably stop here in terms of the statistics and what's going on in Massachusetts and our county. Rakibi, you have to unmute.
Thank you, Dr. Khalid. I will give the screen to Dr. Chima to bring us a little bit of historical and what we've learned from the past, and then how we can, in addition to our current situation, prevent or attack this disease more effectively. Please, Dr. Chima, go ahead and share your screen.
Thank you. So thank you, Brother Khalid, for very useful information. At this point, we are in the probably middle of the pandemic. Time frame is difficult to predict when it will end. But one thing is certain, that it has started, it has involved people, and this virus is not asking anyone their race, color, religion, origin, or name. And one of my colleagues said, coronavirus does not have your home address. Unless you go and bring it home, or somebody brings it and give it to you. So these are the two key elements in this pandemic which we need to pay attention to. Why it is important? Prevention, prevention, and prevention. That's all we have so far. If you had been watching some recent news, some experimental treatments have been used. And last week, I received a handful of phone calls from my patients, colleagues, and friends that a new magic medicine, remdesivir, has been approved. Are we all set now? So I would strongly urge you to read the information about that trial, and it will be very difficult to cover all the trials and treatment in one meeting. You can go on to clinicaltrials.gov, that's a website, and you can look into how many trials are being conducted right now. Treatment part, Dr. Khaldisa, and I will cover in the later part of the discussion. First, I will try to share one screen, and this is the one certification which I got sometime very recently, in fact, but I had been studying this thing for some time. And if you look into this screen, which is,
My screen is shared.
okay. All right, I'm going to go to screen share. This is a Harvard University training program, a very useful site, very useful program. And if you look into what it says, lessons learned from Ebola, which was an epidemic, preventing the next pandemic, understanding the context of Ebola outbreak, what went right, what went wrong, and how we can all do better. So if somebody says that this pandemic came without any warning, I would disagree with that. This pandemic was waiting to happen. Ebola virus crisis taught us a lot of lessons. Did we learn any? That is the key question. In my opinion, unfortunately, we didn't. Had we learned any lessons from that crisis, we would have been more prepared at individual level, hospital level, national and international level. When it comes to coronavirus, people think it is new. Actually, it is not. Coronavirus was discovered in 1960 and had been around since that time. The previous worst outbreak was starting in November of 2002, which spanned into summer of 2003. At that point, over 8,000 people were infected, and approximately 10% of them died. The next Ebola coronavirus-related disease happened in 2015. That was in case of MERS, M-E-R-S. That was a Middle Eastern respiratory viral syndrome. And mortality rate in that was exceedingly higher. When this pandemic started, a lot of intellectuals debated this current novel coronavirus or COVID-19, is it going to behave like first corona epidemic in 2002, or is it going to behave like MERS or somewhere in between? Many people thought it is going to be just another common cold, which will go away. It didn't. Some people thought that this might be only a cold weather virus. And now all of you can see that one. It is not. It is probably all season virus. Even in the middle of January, when in Massachusetts, we did not have a single case. This thing was being debated. This is a cold virus and cold weather virus. At that point, virus was still spreading in Australia and South Africa. And at that time, they were having worst heat of their history. If you remember, Australia was having a lot of wildfires. That is the time frame. Coming on to whether this virus is seasonal, only time will tell, but at this point, probably seasonality will be there to some extent, but this is not only a virus which is expected to magically disappear with change in weather. So why I'm going back to Ebola crisis? At that time, Ebola virus was very infective. Infectivity rate was very high. That could have spread to the world in the same manner as today's coronavirus is spreading. Reason behind that was probably Ebola was confined into an area. From there were no direct flights coming out and landing in every part of the world. Even to get to that area, sometimes it takes a couple of days on ground transportation to reach the area. So the connectivity was not that great. But pathogenicity and infectivity and the crisis was really very heartbreaking. One very famous paper written by Ebola crisis writers and data collected by 6 healthcare workers was very useful, and we are reading it today. Unfortunately, all those 6 people who went to that area to collect the data, none of them survived to see the paper being published. They died before that. 3 doctors from Boston went, only 1 came back. And that is one of the famous doctors who is also part of this lesson from Ebola crisis. And if you click onto the website and listen to the lecture, trust me, you'll get very useful information that will help you prepare to deal with this pandemic and any future pandemic. So at this point, I would probably just keep that information to this extent, that prevention is at this point the mainstay. As far as treatment is concerned, once I make my comments, I'll invite the comments from Dr. Khalid Issa, who's 24/7 in an intensive care unit, and he can give you the information from the frontline defender and fighter, what we have in our inventory. If you prevent, that is your best treatment. If you get sick, then there will be certain things to watch. The question which Brother Rakib asked that will be, what are the updates about the symptoms? The symptoms, if you look into, initially everybody was on the airports carrying those thermometers and electronic devices to check people's temperature. At this point, the literature which I have studied and read, I think there are more than few coronaviruses going around, and some mutation might be possible. Because in China, over 90% of people had first presenting symptom as a fever. So that's why fever became one of the markers for us to watch. On the other hand, if you just look into the research data which came out from New York, which was the first epicenter in our country, only 1/3 of patients had fever. And this was data collected from over 5,700 patients from New York. At that time, alarm bells started ringing that fever may not be only predictable symptom. So CDC added few more symptoms which are in fact already there. So those symptoms could be fever being one, cough, shortness of breath or difficulty in breathing. And then they say that probably if you have at least 2 of the following symptoms, you should think about coronavirus infection. Fever, chills, repeated shakes and chills, muscle pains and aches, headache, sore throat, new loss of taste or smell. To make your things a little bit easier, let me just give you the information about this virus, what you need to look into. Please start from your nose. Behind the nose, nasopharynx. Go into the upper airway. In the nose, you will have the nasal irritation, discharge, and so forth. In the nasopharynx, you will have those symptoms of cold and flu-like. Then it goes down into your lungs. It will give you shortness of breath. It can cause cough. If it goes into the body and general direct viral symptoms or virus symptoms due to the disease and some mediators which are released, people can have muscle pains and aches, headache. And then loss of taste and smell, at least 4 or 5 patients which I have seen, they had the only symptom, loss of taste and smell. Why? The virus just goes into your nose, and right above the nose is a caribriform plate where there is the one of the nerve which senses your smell, and then in tongue you have got nerve ending which is affected by this virus, which can interfere with your taste. So mouth and nose come first. Or there could be some very early symptoms in this disease. So this data is basically updated by CDC based on all what we learned from New York. Some things were added what we learned from New Orleans. Initial information was learned from China and from West Coast. And this virus is capable of getting into your whole body, and it is predominantly a virus which attacks ACE or angiotensin converting enzyme type 2 receptors, which are in abundance in the lower part of your lungs and in pretty much every blood vessel, which is part of the blood pressure treatment and cardiovascular health, which we'll cover later in this topic. So covering on to the symptoms wise, who needs to seek medical attention? Basically, if you have any doubt about the symptoms, please call your doctor. There's no need to call that Haladisa or me. First line of your communication is going to be your own primary care doctor. But as a community members, we will be available to give you some advice, but that advice cannot replace your own doctor and your own hospital. Persistent pain, cough, pressure, and some people, they can have just a very change in their mental status, like becoming confused or becoming more irritable. Having a word of caution over here, after 2 months of quarantine, many people are becoming irritable anyway. So that doesn't mean any person who is irritable and nervous, they should be running to their doctor for corona testing. And the other thing which recently published by a couple of guidance documents, which again come from New York, is a lot of people, they were having drop in oxygen saturation. They were becoming hypoxic. So they suggested that if you have the tools and to check for drop in oxygen saturation, you can do it, but they did not recommend start buying the tools to monitor your oxygen saturation at home. At this time, I'll just take a brief pause, and that Khalid Issa, being the specialist in oxygen saturation and pulmonary issues, I would like to get his comment for all the things which I have so far said, and if he has something to add. Dr. Khalid Issa, please.
Jazakallah khair, Dr. Shima. So I'm just going to, okay, I'm going to go ahead and talk about the treatment and what we do at the hospital.
Yep.
Just before I go into this, I mean, definitely prevention, like Shima said, is the #1 measure we can take. There is no cure proven for that coronavirus. However, with each hardship, there is always an ease. One of the major blessings or ease with that virus that the effect on kids and younger age is very, very minimal. A lot of the younger age and kids don't have any symptoms, or they may get a fever for 1 day or 2 days and it's gone, the back number. So that's a major blessing from Allah subhanahu wa ta'ala that it doesn't affect kids. The other thing that you should know, that overwhelming majority of the people who will get coronavirus will recover. This is not a death sentence by any means. And right now, I think in the United States, we're talking about a mortality rate of people about 5.5% or closer to 6%. So this means from each 100 will get it, 6 will die. So that's a small minority as well. What's scary is that this virus spreads very quickly and very easily. So even that 6% or 5% we're talking about is a large number of patients. That's why you see a lot of people have died from the virus. A lot of people would even have no symptoms at all. They wouldn't even be aware. There was a study done in New York, and they tested a large sample of random people and found that 13 to 14% of actually patients of random normal people in the community had antibodies in their system. This means that these people got exposed to the virus, but they never had symptoms. Their body was able to overcome it, develop antibodies for it. This is great, right? We have a lot of patients who have, the other people don't have any symptoms. Scary at the same time because these people are transmitting the virus to others without being aware, and that's what comes to the point of social distancing. Not just looking for people with fever to stay away from them, just the general idea of social distancing and trying to slow down the community spread. Now, I just want to go to the hospital, what we do in the hospital. I mean, basically, there is no proven treatment for COVID-19, and the main treatment is yet supportive therapy. So patients will come in. Usually a lot of patients we actually send home from the ER. We test them. If it's positive, they go home, we check their oxygen level, check their breathing. If they do okay, the labs are okay. we do a chest X-ray, and then we send them home. A small minority of patients will stay in the hospital, mainly the elderly or people at risk. What we do is basically we admit to the hospital, watch them. If their oxygen level is low, we give them oxygen. And then we go ahead and keep escalating the amount of oxygen we're giving if their oxygen level keeps going down. And that's what comes the scary part. There is only so much oxygen we can deliver without a ventilator or respirator. And if the oxygen level goes very low, and despite giving them regular oxygen through the nose, we may end up moving them to the intensive care unit and putting them on the ventilator. So far throughout the country, patients who end up with the ventilator have a very high mortality rate, and the minority actually are able to come off the ventilator, and this is unfortunate. And so this is in terms of the general overall supportive therapy. We give the patients fluids if we think that they are dehydrated. Coming to certain medications or certain treatments that target against the virus itself. You probably all heard about the remdesivir, and it's being approved from the FDA to be used as a treatment. It's not a magic bullet. It's not the antibiotic you take for your strep throat that it's gone within a couple of days. It doesn't work this way. If you look at the information, and actually can share here on the chat section the results from the remdesivir trial. This is a very well done trial in American hospitals. It showed that it actually makes the recovery time less. It made people recover overall. The average, the patients who got the remdesivir recovered within 11 days, and the others who did not get it, who got the placebo or the false medication, recovered in 15 days. So this is definitely a positive effect. However, if you look at the mortality rate or how many people died in each group, the group that had the remdesivir and the group that had the placebo, the group that had the remdesivir had a mortality rate of about 8%, and the group that had the placebo had a mortality rate of about 11%. If you know a little bit about statistics, this number was not statistically significant. It wasn't a significant difference in mortality. We call it a trend. So probably remdesivir has an effect, but it's not a magic bullet. It's not a reason for you to let off your guard and go out to the community and say, we found a cure. If I get the coronavirus, I'll take the remdesivir, and that's it. It doesn't work. We're not there yet. Definitely more information to come over. There is an antibiotic drug from Japan currently being tested. Not sure about the timeline when we'll have the results. With other investigational therapies that we are trying at the same as well is plasma transfusions, convalescent plasma. So we try. This is organized. This is arranged throughout, actually, by the Red Cross throughout the country. So people who had coronavirus and recovered, they go to the Red Cross, and I actually encourage anyone if you know someone who had the coronavirus and recovered to do that. They go to the Red Cross. They donate plasma. So the idea is that these people have antibodies to the virus in their plasma. So we take this plasma and we actually give it to the very sick patients in the hospital, trying to use these antibodies to help them fight the virus. However, this is not a proven treatment yet. Theoretically, it works, and it worked with previous coronavirus in the past. So we're assuming the same way it will work with the coronavirus. A lot of times we end up giving patients antibiotics because sometimes it's different. It's very hard to tell if they actually have a real bacterial pneumonia versus a viral pneumonia. There are a number of very debatable treatments, including steroids, including medication that suppress the immune system. The idea is to at least lower the inflammation a little bit in the body so the patient can recover from the virus. These are all investigational treatments, nothing proven to work yet. And to be honest, people try different things, and no one has a clear picture how to use these medications yet. Most likely, the remdesivir will be available starting tomorrow. This will be it will be, I think, depending on where the most outbreak is, in areas will get the antibiotic from there. Other things that you may hear about is stuff like vitamin C, zinc, etc. Again, none of these has proven to help with the coronavirus. We know from other trials from other diseases like common cold that taking vitamin C can help you recover from the cold faster. The same for zinc, that it may have some little bit protective effect against common cold. People are using it. Please don't believe what you read in the news about this random doctor somewhere who cured his patient with zinc and vitamin C, because it doesn't work this way. Most of the people actually recover. So if you take 100 people and you give them zinc and vitamin C, 95% of them will recover. This doesn't mean that the vitamin C and zinc work. Again, this is not, it's relatively harmless to use vitamin C or zinc as long as you use it within the recommended doses. I cannot recommend for anyone to take it or not take it. If you take it in very high doses, that can be harmful. And if you take, it can actually lead to diarrhea, etc., and other side effects. Zinc also can affect the absorption of other important elements for your body. So there is no, I mean, if you're going to take them within reasonable, within the recommended doses. There is nothing really proven to help with this. So I'm going to pass to Dr. Chima or Rakib.
Thank you very much, Brother Haladisa, for all that very interesting and useful information and emphasizing about the research trial. So I just want to cover something which is my personal research and opinion. We are in the middle of pandemic. We are looking for a cure. We are looking for any hope. As a believer, we know where our hope is. As a scientist and as a physician, in parallel, we will continue to work on medical and curative hopes as well. If you look into the summary so far, this virus does not have any established or curative treatment yet. Key thing is prevention. And God forbid, if you develop any infection, there are 3 levels of this infection management. As soon as you have the symptom, you contact your doctor and you get tested. And if you are positive, please isolate yourself right away. And remember that you should already be doing social distance measures and all the protective measures in place. Now, on top of that, if infection happens, that person must be isolated in one room in the house, which can have what I call negative ventilation. Instead of his breathing and ventilation circulating in the house, keep his door closed, and if weather permits, maybe open up the window a little bit. So instead of virus circulating in the house and getting into your heating and system, it should be going out, and that person should take care of him or herself, including washing anything they touch, cleaning anything they touch. So as Brother Haladisa said, more than 80% of people will make very good recovery without doing anything, just prevention and general care. If your symptoms start getting worse, then of course some treatment might be initiated by your primary care physician or your consultant in-home setting and carefully monitoring everything. So then you need to identify at what time to go and see your doctor or go to hospital. Please just don't show up in the ER or into your doctor's office. If you think that you have already been diagnosed with corona, call your primary care physician ahead of time that you are coming to see him or her because you are not feeling that good. And if you have to go to your doctor and if he permits you to come to the office, then go over there. If he directs you to go to ER, then you go to ER. If you are able to drive yourself, don't have any friend or family member in that car. Because in that car, which takes 15 to 20 minutes to ride to the nearest hospital, probably you will infect the other passenger by the time you get to the hospital. So both patient and the caregiver be using masks. And when you get to the hospital, then doctors like Dr. Haladisa will take care of you from then on. That may include admitting to the floor, providing all the support and all the care you need. And then if condition deteriorates, patient will be transferred to the ICU. Coming on to the very much hyped and very much discussed treatment of remdesivir over the weekend, but Brother Khalid Isa can also add on over here, this medication we are not giving to any person who's diagnosed with corona infection, or even moderate cases we are not giving them. This medication at this point is being reserved for critically sick patients who are either on ventilator or whose clinical condition has deteriorated. Brother Khalid Isa, is that correct I'm saying, or you have something different in opinion?
No, definitely agree.
Okay, so other question which you need to look into, don't look towards remdesivir as a treatment. You don't want to get there. You don't want to get that sick that you are intubated or you are in a critical condition. And on top of that, the company which manufactures this drug, they have projected they will be able to make 1.5 million doses by the end of May. And each patient needs, Dr. Khalid, is that first loading dose is 200 milligram followed by 100 milligram a day?
I think that treatment we get about there was a study between 5 and 10 days, so at least 5 days of the drug, and I think it's twice a day.
That's right.
Yeah.
So if you look into 1.5 million doses, and each patient will need 5 to 10 doses. The number of the doses which you are left with available from the company are how many? So you can do your own math. And basically, medication is still being used as what you can call, it is not FDA approved drug. There's a difference between FDA approved drugs and emergency use authorization. So this drug has been given a status of emergency use authorization. Is that correct, Brother Khalid Isa? So under that category, this drug will be continually monitored in the coming weeks to months, whether this medication is beneficial or not. And if it is, how much? I can just give you a one small example of that one. A few weeks ago, you heard that FDA has allowed hydroxychloroquine and zithromycin emergency use authorization. What happened to that? That has now been being discouraged that we shouldn't be using it. Why? Ongoing data showed that it is causing more harm than good. And the trials which we have on remdesivir, they are being done in the patients with two key parameters which every researcher should look at. Is this medication or will this medication prevent the death? Or at this point, the current data availability, as Brother Khalid Isa mentioned, only hope it is giving you is instead of patient being in hospital for 15 days, patient can be discharged home after 11 days. So it is shortening the duration of those patients in ICU. So having said all that, my emphasis is still going back to the original screen, which I'm going to pull back. Lessons learned from Ebola, preventing the next pandemic. We have miserably failed to prevent the next pandemic, which was forecasted 5 years ago. For 5 years, we had, as a medical profession, as a institution, as a nation, or as a world as a whole, we have not paid attention to prevention of next pandemic. Now, in the middle of pandemic, you will see people are doing two things at the time. 2 weeks ago, I was able to keep up with all the research papers. In last 2 weeks, I have not been able to read all the research papers because now we have two pandemics. One pandemic of coronavirus going on, and second is the pandemic of research papers. Every few hours, a research paper is being thrown into the media. And one very important research is being at this point conducted, which I will probably pay attention to, is collaborated between Massachusetts General Hospital and King's College, London, where I studied and researched for over 5 years, they are trying to collect about over 1 million patients' information to look into this thing. Symptoms. How predictably and reliably symptoms can be utilized as diagnostic criteria. And that will tell us in the coming future, it is not a trial, it is a cohort, it is same as collection of the data in Framingham and other places. So basically, coming back to the basics, I really don't want to confuse people who are listening or people who will be watching this video later on. Research is very complex. Pandemic is very complex. And at this point, we need to look into some questions which were put in by Brother Atif. The handover which he gave to us what we are going to do today, tomorrow, and in future.
Yep.
Yesterday, we were able to do it, or what we should have done it, we didn't do it. What went right? People identified Ebola crisis. What went wrong? Preventative measures, they were not done properly, and once they did them properly, whole epidemic was curtailed. And how we can all do better. And that is where the whole treatment is. Second surge is possible if we slack off, if we don't follow the rules and we don't take care of the things. And this is kind of my assessment that in coming months, you will see people will have a choice to make between stay home and having no food to eat, or having economic hardship, or just going out and do what they can to make their living. Sooner or later, country will be opened. And once country is ready to be opened, we need to do our part as a good citizen. At this time, the test which I'm aware of, the random testing which we are doing in Massachusetts, between 18 to 24% population is infected. In Alaska, they are not doing as many tests, but as of the data which I pulled from the site this morning, their rate was approximately 2.8% general population being infected. We test more, we diagnose more. The current mortality rates are highly alarming. United States mortality rate is approaching about 5%. If you remember initially at the beginning of the year, people were saying the mortality rate is going to be close to any common flu. Common flu and influenza mortality rate is less than 1%. In the best case scenario, probably 0.5%. And if it is 0.5% and we are dealing with 5%, that means 10 times more fatal or serious than common influenza. So it is not influenza.
Yes.
So that part is probably already there. However, one caveat to that is, tomorrow, let's say you test another 2 million people in Massachusetts, they all come back negative, that will change the denominator. Infectivity rate probably dip down. That's why testing of everybody is so important. So we can get the real picture, how many people are infected and how many people are dying. As of last night, when I checked the statistics, close to 170 healthcare professionals, including one of my class fellow and few friends in England, have died of corona. And few of my colleagues and friends I have lost in this country. So infection is there and infectivity rate is there. National Health Service in England is probably getting close to being buckled, and 170 plus healthcare workers succumbing to this disease. Of course, PPE is very important. Of course, prevention is very important. So we need to do everything possible. Any one of you who does not get infected and does not show up in hospital, trust me, you will be helping Dr. Haladisa in ICU, and you'll be helping your other physicians in the hospital, so they won't have to get another patient to treat with. So this is the community needs to play their role by making sure they don't get sick and they don't end up in hospital. Hospitals are doing the best what they can. England mortality rate is approaching 15%. Chinese mortality rate is north of 5%. Italian mortality rate is more than 14%. We are fortunately close to 5 or maybe 6%. So far, the lowest mortality rate to data collection which I did this morning was Germany. And before I conclude this one and we make the forum open for questions, I would like to give you one very eye-opening information about the mortality rates and the infectivity rates. January 26th, we had 0 case in Massachusetts. That is when infamous medical meeting happened in Boston. January 1st, we had first case diagnosed in Boston, followed by second case. How many cases we have today in Massachusetts? Last minute when I checked, 66,263 with 3,846 deaths. Let's compare another country, Taiwan, very next door neighbor to China, with almost 23 million population. Massachusetts population is about 6.8 million. They had less than few hundred cases in January. And as of last check, which I made, they still have only 432 cases with only 6 deaths. So what you look into Ebola crisis, what went right, that is in Taiwan. What went wrong is elsewhere. The partial opening, which Brother Akib asked, if we go on to that one, Korea very recently tried to open up suddenly, and suddenly they saw the resurgence of cases. And they immediately scaled back and they said, we need to do contact tracing. What is the contact tracing? Last week, when I saw one person which I knew in a public place without mask, the person who was diagnosed with corona, I couldn't believe it, but it happened. So you basically do not know person next to you is positive, asymptomatic carrier, or he has been recently diagnosed positive corona, but he is stable enough to stay home. So the lesson is, please assume every person next to you are walking around, even at least by the statistical number, 1 in 5 people are infected in Massachusetts. Who's that person standing next to you? So you need to take all the precautions. So that's where I will take a pause. Information is so much.
Yeah.
I can keep on talking probably for next 2 days nonstop, but we need to do the rationing of the time.
Yeah.
So just Brother Q, I'm just gonna with that add Dr. Shima, just add a few points. That definitely the hydroxychloroquine and the azithromycin that was a lot of was publicized when the beginning of this pandemic. We definitely stopped using this. The multiple recommendations have been out to stop using it, not just because it's not effective, but also it might be harmful. And just my own experience using it, I haven't seen any effect. In terms of the prevention, like I've talked about earlier about the vitamin C and zinc effect, to be honest, a typical patient in our ICU, I'll be honest with you, in our ICU on the ventilator is someone with obesity, diabetes, and hypertension. That's our typical patient. So if you would ask me, what would be one thing to do to prevention, apart from social distancing and the usual precaution, I would say just go for a healthy lifestyle, exercise, eat healthy, a lot of vegetables, a lot of fruits. That probably if something would work for you would be this way. And it's not just going to protect you from the coronavirus, it protect you, inshallah, from multiple other illnesses. In terms of the one other thing I want to add on, there is still a lot of debate whether someone who had the virus can get reinfection or not. Do they have immunity or not? This is not something this is not something clear yet. We know that people generate antibodies to the coronavirus, but we don't know if it's protective or not yet. There have been some reports of people being retesting positive afterwards, but the last report that these positive tests are false positive, or just basically they may be just still having some of the virus DNA, and then when you do the test, it's positive, but these people have not had the actual illness again. However, still, this is not very clear yet. The other thing I want to add on is, I think we talked with Shima about this. Please, if you have other medical conditions and it's urgent, if you're having a chest pain, if you're having other urgent condition that needs medical attention, by all means, go to the hospital, check with the doctor, go to the hospital. Don't sit at home and wait for it. We have seen really bad stuff from people just afraid from going to the hospital. Dr. Chima probably can talk about this more, but the number of heart attacks coming to the hospital have declined quite dramatically with the coronavirus. Coronavirus did not prevent heart attacks from happening. It's still happening, but people probably still sitting at home, afraid going to the hospital. I'll give you a small example. We had a patient who came to the hospital not because of coronavirus, stayed in our hospital for 40 days, 40. Came out of the hospital. We tested him positive. We tested him before going out of the hospital, and he was still negative after 40 days being in the hospital for another medical condition. The hospital have been doing their best to isolate non-coronavirus cases. We have separate units in our hospital for non-coronavirus. Every patient being admitted right now is being tested. So everyone that is negative are actually having a separate unit away from the coronavirus cases. The other thing I would like to add is, everyone knows that this has a lot of psychological and financial burden on people. This is not easy. What we're going through is not easy. Apart from what's happening in the hospital, what's happening in our homes is very hard, and a lot of people going through a lot of financial hardship and a lot of psychological hardship as well. But believe me, what we see in the other side as a medical community, we don't want to scare you, but it's pretty bad when people get worse.
Thank you very much, Brother Haldis. That was very useful information. I would like to add a couple of comments over here regarding coexisting conditions. So far, the data collection wise, high blood pressure is considered to be #1 of the major comorbidities in corona infection, followed by diabetes and chronic medical conditions like lung condition, COPD, and previous heart condition. American College of Cardiology last week sent us a brochure where they implied that at this point, heart attack visits to hospitals have gone down between 30 to 45%. So as Brother Haladisa said, you cannot cure your heart attack. So what is happening with this? So all other conditions are going on. People still have brain and they will be getting stroke, still have the heart, they can have heart attack and other medical condition. Just speaking of the hospital where I work, I can assure you, if there's any other medical condition for which you need urgent medical treatment, we are keeping corona patients completely separate. To this extent that this week, 2 of my patients who needed urgent cardiac procedure, or you can call it elective procedure, which is being recommended not to be done, but these patients required a cardiac procedure need to be done. We take them to hospital, we take them to the lab, we do the procedure, and sometimes we discharge them home on the same day. We don't even admit them to the hospital. However, if patient condition requires admission, we keep them separate from corona patients. So at this point, please do not ignore all other health conditions. We cannot just stay focused to corona and forget about other things. And at this point, we are also assuming there could be 2 possibilities. Of course, corona cannot cure the heart attacks. Either people are not having, they're not calling, or they're not mentioning their symptoms to their doctors. And second thing, which will be researched in coming months, is that change in lifestyle, healthy eating, exercise, all the preventative measures, and all that stress management, not getting on the road 4 o'clock in the morning. Is that also helping to decrease the heart attacks? Yes, it could be possible. So the key elements are, at this point, please prevent the disease, boost your immunity, make sure strong enough to handle any disease or corona, and then do all of your prayers, what you need to or what you can. And if you need to seek medical advice, hospitals are not a trap for you. That's not that over there you go and you will be mixed with the corona patient and you'll come out with the corona. If you went in without corona, and inshallah, and with all the precautions which we are taking, you shall come out without corona infection. And right treatment should be delivered to the other medical problems as needed. And as of today, for last many days, we are seeing a downward trend for the hospitalization, downward trend in the ICU admissions. I think as Brother Khalid mentioned, we are in a plateau phase. Next phase will be curve going down, and there is a hope, there is a reason to believe that we are heading in a right direction, but we cannot let our guards go down. Vigil need to be continued along with precautions, because as you so know that soon the summer will be over, we'll be approaching fall time and winter time, and a second coming back of the corona mixing with flu virus could be a potential problem.
Thank you, Dr. Chima and Dr. Khalid. I will just want to summarize quickly. I think we're coming up on top of the hours, but we'll add 10 more minutes for to answer some questions that came in, if that's okay with everyone. But just know we've been talking about the last update about coronavirus. There are 3 key points from my end I took down. Is that the very first one is prevention. There's nothing better than prevention. How do you prevent? Do not go in public places. Social distances. Even if you do take your precautions, your measures, you come home, you're safe from yourself, your family, and don't jeopardize anybody's health nor yours. The second one is that there are a lot of carriers out there, meaning people who are affected but don't manifest the symptoms. So again, this comes back to prevention. If you go and socialize with people, let's say you picked up on few family and friends, and you've been doing Taraweeh together, you don't know who they also going after. Socializing with. So just be careful. I know there's a lot of us want to go back to the masjid. When should we go back to masjid? We'll cover that in the Q&A. And then the third one is the drug that was approved just this past weekend. It's not for prevention. It's for critically ill patient. The patient who are in ventilation support. I was reading a paper the other day. People were mentioning that, as actually Brother Khalid also mentioned, that people who go on ventilation have high mortality rate, which means we don't know if ventilation is the one doing that, or if the disease state the level at. So this drug is, inshallah, to supplement that, and we'll see few, and then also complement the limitation on ventilation, because that was one of the concern from the entire country when this thing started breaking out, because we didn't have a lot of ventilation to put people on. So inshallah, this drug it did not go through all the clinical phases. I don't even think it went through phase 1 yet, but it had fast track approved. So it's been allowed to be to use for only critically ill patients, i.e. the ones on ventilators, so that we'll see the needs of ventilations come down a little bit, inshallah, with the use of this drug. And then don't take it as it's for you, so therefore you could go and go outside of your preventive measures. So again, it comes back to prevention. We'll go on Q&A sessions. We have few questions. I think some of them has been addressed. The heart attack, high risk or heart condition patients. There is one that picked my mind. Which is very interesting, is about what do we learn. I think this will segue nicely into quarantine. What did we learn from other countries like China, New Zealand, or even Germany as an example, as far as easing quarantine? If you can comment on that, that would be really good, inshallah.
Dr. Khalid Issa, I'll invite your opinion.
You're muted. You're
Yes.
muted.
Okay, great. To be honest, this is not an easy question to answer, and it takes a public health expert to answer this question. There is always a concern that when we're going to be easing the precautions, you have a second surge, which happened in other countries. I don't know if you can see. I mean, it's just to let you know that Italy and Iran, although they started way before us, they still have a good number of new cases coming over. I'm biased because I work on Brockton, which is a very hot spot. At least Brockton itself is not anywhere close to easing the precautions. I would leave, to be honest, this question I would leave to the people in authority to answer. I don't know, Dr. Chima, if you have any other questions, any other addition to this answer.
I mostly agree with you. Only time will tell when these countries start easing. They will be easing due to political and economic pressures. Some countries will be doing that way. Medical logic must prevail in all the environments. It is a healthcare disaster. And at the same time, we also need to take into account socioeconomics and general and mental well-being. So there will be multiple factors which will be playing into that opening versus when and not opening soon. So a lot of work is going on that end. So answer is, at this point, we do not have a definitive answer. And even epidemiologists are juries out there, people who are listening to Dr. Fauci and other experts in that one. They are very cautious about opening up the economy and the states.
And even when they open up, I will be very cautious going in. I wouldn't be the first one running into public spaces with open arms. I would take it very easy, very slowly, test the water before you get into it, because a second wave is very possible, which also happened with the pandemic that happened in the last century, in the 1918, with the second surge happening when they eased the restrictions.
That's a very important point. The Brother Khalid, 1918 pandemic, that the way it came in the waves, and in certain countries, in the second wave, it killed more, it killed in the first wave. That's the point, right?
Yeah, so I think if I understand correctly, to answer somebody's questions, when should we expect going for Eid prayer? Most likely not.
Yeah, again, inshallah, even if we do, it's going to be a very special Eid. It's going to be prayed the same way we used to pray every other Eid before. I can't imagine praying Eid with 6 feet apart. I don't think this could be even doable. But let's pray, inshallah. Let's make just the most out of the current time we have. This is a very special Ramadan, so we'll try to make the best out of it.
At this particular point, I just have one position point to add. That is apart from the medical discussion. This is purely on my own spirituality and being a Muslim. This pandemic is unprecedented for us. It is not unprecedented for Allah subhanahu wa ta'ala. Mm-hmm. Allah subhanahu wa ta'ala has humanity into this type of situations in and out many times before. So at this point, I am continuing with all of my prayers with this position that every tough time has its own hidden goodness behind it. May Allah subhanahu wa ta'ala keep all of us alive and safe to see those hidden blessings of this pandemic.
Ameen.
And inshallah, it will be coming to an end sometime. Allah subhanahu wa ta'ala knows better. But as it is said very clearly, if you want to pray to Allah subhanahu wa ta'ala, tie your camel first and then you pray. Prophet Muhammad, peace be upon him, very clearly said, if there is a plague in the town, don't go in, and the people who are affected, they shouldn't come out. So this is the quarantine concept, which is more than 1400-year-old. And in today's modern time, the modern world hasn't learned it carefully and fully yet, if Ebola lessons are any lesson for us.
Yeah, I think we cover a lot of things, and hopefully everyone find this insightful. I did, and I enjoyed speaking with you guys. May Allah put barakah in your time. May He continue blessing you and your family. May He protect you guys for being the first responder and protecting us from contracting the disease. But we have to tie our camel, as Dr. Chima said. Prevention, prevention, prevention. To that, I would like to thank you for your time again. And inshallah, we'll meet again soon to when we feel appropriate to give another update.
Inshallah, brother, at the end, just I have one more word to add. As the treatment part is concerned, which Dr. Brother Khalid Isa covered very well. At this point, if any one of you or any in the community who has been infected and recovered from coronavirus, this is to let you know that even Norwood Hospital is doing convalescent plasma treatment, which is your own local hospital. We are providing over there state-of-art care, keeping people separate in the separate units, and the routine care of all the heart attack, stroke, and other medical problems is being done very diligently. And I can very proudly tell you that the Ethical Review Board has approved our hospital, which is our local hospital, for plasma treatment and convalescent plasma treatment. If you think you are a candidate and that person who can donate that, please reach out to Norwood Hospital directly or to the local Red Cross, and you could be the one who might be saving another life. As far as my personal research is concerned, I believe convalescent plasma may be more effective even than other available treatments which we are trying. And may Allah subhanahu wa ta'ala protect you and bless you all and all of our country and all of our humanity.
Yeah, just one thing to quickly add for the convalescent plasma, because it's the Red Cross right now. We're just taking all comers. Anyone, even if you just had the symptoms of the coronavirus, and even if you were not tested, the coronavirus will screen you for the antibodies, and if they're positive, they're gonna accept your donation for plasma. I put here the link. You don't even need the link. If you just type Red Cross convalescent plasma for COVID-19, you will easily accessible. You fill out an online form. They'll let you know if you're eligible for donation. Please, if you know anyone that can be a candidate, they should have just had the symptoms and recovered completely from the symptoms, please refer them to this. There is a local Red Cross donation site that will very easy collect the plasma.
Thank you.
Thank you. Thank you, and thank you everyone for tuning in. We have other programs. I believe the next program is at 4 p.m. Make sure you tune in with your kids, and have a blessed day and the rest of your afternoon back. Jazakallah khair, Dr. Khalid and Dr. Chima.
Brother Akib, thank you. And Brother Khalid Isa, thank you very much for your information.
Thank you, Shima. Thank you.
Okay, assalamu alaikum.
Ramadan Mubarak.